My name is Erica Mergel. I'm a licensed social worker here at the Recovery Center. Um, what is your name? I just want to make sure that I have the right patient here.
Robert Brooks.
Okay, great. Well, it's nice to meet you, Robert.
Nice to meet you.
Can I call you Robert, or do you prefer Mr. Brooks?
Robert's fine.
Great. Now, Robert, tell me exactly what the purpose is of you wanting to see a counselor today.
Trying to get into a recovery program for drug problem I'm having.
Okay. Well, you're making the right choice. Would you mind telling me your drug of choice?
Well, it's cocaine mostly, but I also smoke pot and I've been drinking more frequently.
Okay. How long have you been using?
Well, cocaine for about the past year and alcohol and pot for about 10 years. I would say I was abusing it, I was just using socially.
Okay. What made you start using cocaine?
Well, my mother passed away last year from breast cancer. She had it for about 4 years, and I watched her it just sucked the life out of her, and it did the same thing to me. After that, I got to the point where I stopped caring about life, and my mother was all I had because my father was never around, and he didn't even come to her funeral.
Mm-hmm. It sounds like you're pretty upset with him.
Yeah, definitely. I can't even stand him. If I saw him, I wouldn't even pee on him if he was on fire.
I understand. Well, okay. Now, how often and how much do you use?
Well, I experiment with cocaine before I jumped in heavy in the past year, though.
Okay. So you experimented with it before, and then so just in the past year since your mother passed away, you've pretty much just jumped in heavily. Is that what you're saying?
Yes.
Okay. So now, currently, like how often and how much are you using?
Well, for the past 3 months, it's every day, pretty much all day, probably an 8 ball about every 4 days.
Okay, so an eighth of cocaine every 4 days. Wow, that's a lot for one person. Have you experienced any negative consequences from your drug use?
Yeah, I lost my job because of a dirty UA, and that was about 3 months ago. I'm behind on all my bills, and I received an eviction notice last month. As of now, I have 3 days left till I have to get out.
Okay. So, do you know where you're going to be going or where you're going to live? Or it sounds like you're pretty concerned that you...
Yeah, I don't have anywhere to go, really.
Okay. Do you feel like you've hit rock bottom?
Yeah, I'm pretty close. Rock bottom, probably the streets, but I'm tired and I know I need some help.
Okay, Robert. Well, I am very confident that here at the Recovery Center, we can help you. It's going to be a long road ahead of you. I can definitely say that. Just because of all the underlying issues, the anger issues with your father. It sounds like you have a bit of resentment, and those things must be resolved just to prevent you from relapsing. And then, of course, the most important thing is going to be getting you started on the grieving process of your mother. In my experience, I see that when you use, you kind of push down that grieving process. So you've never given yourself time to grieve. Are you willing, and you actually prolong that grieving process, are you willing and open to the healing process?
Yeah, I'm ready.
Ready? Okay. Robert, So what I've heard you say is that you have been using cocaine every day, about an 8 ball every 4 days or so, for the past 3 months. You've been using cocaine for the past year, though, since your mother passed away. Again, you started using cocaine about a year ago after your mother passed away from breast cancer, and you watched her suffer through her breast cancer that she had for 4 years. You felt that your mother was the only thing that you had. That was the only reason that you were living. And it sounds also that you have some resentment towards your father and towards or really because of the neglect from your father. And then also, it sounds like you're a bit angry at him for not coming to your mother's funeral, and that's completely understandable. And would you say that that's correct?
Yeah.
Okay. And then also you have lost your job due to a dirty urinalysis test. You said that you are behind on all your bills, and you received an eviction notice last month,
Yeah.
and you have 3 days to move from your home. Did I get that right?
Yep.
And then you also insinuated that you are tired and you're ready for treatment. Is that correct?
Yeah, I am.
Okay. Okay, Robert. Are you ready to get checked in today?
Sure, I don't have any place else to go.
Okay. Now we can get you started and get you started into the detox process, and that's going to last for about at least 3 days. Okay. And we'll help you through the detox process. I know there are probably some concerns with your furniture and stuff like that. I know you have to move out of your apartment in 3 days. What we can do is we can make some arrangements, because I would like for you to get into treatment as of today. But we can make some arrangements to get your furniture and stuff like that out of your apartment. Do you have any family members that can help you?
I might.
Okay, well, we'll try to get that process started, and I definitely want to try to get you in detox as soon as possible. But what I'll do is I'll send you over to the intake specialist. They're going to do a more in-depth evaluation, and we'll set you up for a 90-day treatment program. It's a pretty intense program. There is some counseling, some therapy also involved, and we will try to help you with some of those, some of the issues, the grieving process that we spoke about, and then also just trying to figure out how, not necessarily that you can get over the anger that you feel for your father, but just being able to accept things, just for yourself, not necessarily for him. And again, we will make arrangements to clear out your apartment. So how does that sound?
Sounds good.
Okay, Robert, well, it was so nice meeting with you today, and I'll be checking in with you. In about 3 days, I'll come by the center, and we will set up a follow-up appointment so we can talk a little bit further, and we can talk about anything that you're feeling, because again, you haven't gone through the grieving process, so we want to talk about that after we clean out some of the drugs out of your system. So how's that sound?
Okay.
Okay. Well, Robert, I will see you in about 3 days or so, okay? So good luck to you.
Okay.
All right? And if you need anything while you're in detox, you can just tell the specialist there, and they can just call me, and then I can come right over and talk with you, okay?
Okay.
All right, great.
Thank
All right, thank you. All right, and then you can just walk right out here, sir, and we'll meet with the intake specialist. Thank you, Robert.
Thank you.